It's nothing new or nothing kind of a space technology. It's something very simple. The Accurhex, the accurate Rhexis marking device or the system which I modified or designed. As we know that a punctual artist will draw a sketch in pencil on his canvas before finally painting it in colors. We use dots or marks even for making nice rangolis. Architects and engineers use the stencils before the computerized AutoCAD era. Occasionally, even bowls are used as stencils. And we all use bangles as stencils in our MBBS years. Then, as a punctual surgeons, why should we not make a mark on cornea before doing the capsular Rhexis? So here is a set of instruments I redesigned and video tips showing how to achieve a good quality accurate capsular Rhexis, as accurate as manually possible, especially helpful in widely dilated pupil. Accurhex is especially helpful to those of us who still do not have access to the femtolaser capsular Rhexis. My Rhexis marker is limbus based because you don't have to respect the angle kappa or angle alpha while doing the Rhexis. What you want is the Rhexis should be in the center of the lens, and the lens is centered to the limbus, so it can be used even in mature cataract or any other cataract. The device set consists of an Accurhex, which is a limbus based marker, and a globe stabilizer which I have named as a Christ hook. This is the limbus based Rhexis marker, and this is the Christ hook. We'll see the use of it in video. With the Christ hook, you can easily manipulate the globe if the patient is deviating his focus. And when the outer ring is matched to the limbus, the inner ring will give you a nice, well-centered 5.5 millimeters Rhexis. The other Rhexis marking, for the other shorter Rhexis marker, you have to find the center. But here you don't need to find the center because it is based on limbus. And while starting the Rhexis, if you match the fourth to the first Purkinje image, this is the corneal image and this is the posterior surface of the lens. So if the first and the fourth Purkinje image are matched to each other, then you know that the parallax between the anterior surface of the cornea and the anterior surface of the lens is gone. And trying to keep the match between the first Purkinje image and the fourth Purkinje image, start your Rhexis and go around the Rhexis, remaining within the marking. An appreciation of this fourth Purkinje image and the first Purkinje image is an excellent alignment tool to give you the perfectly aligned center Rhexis. Even on IOL, you can see the first Purkinje image and the fourth Purkinje image, and with a tilt of the eyeball, you will be able to perceive that. This is the Purkinje image from the anterior surface of the IOL, and a faintly seen Purkinje image from the posterior surface of the IOL. And when you align those two, you will be able to see that the Rhexis is fairly well centered to the Rhexis mark as well as to the IOL. So after doing 180 or so cases, we did analysis after 2 months post-operatively, taking slit lamp videos and trying to measure the parameters. And we realized that good centration improved from 75% to almost 95%. A good circularity improved from about 60% to 91%. The Rhexis modification rate after IOL implantation decreased from about 40% to 8%. Full overlap was achieved in majority of the cases, and the size accuracy was fairly improved. So to conclude, Accurhex corneal marking system before performing Rhexis improves its and also the overall outcomes in every respect. And investing ₹9,000 and half a more minute per surgery can help us a lot. Thank you. Well, when done freehand, this smiley may look rustic and beautiful, but when done with a precision marking, it looks perfect. Thank you.